Well, hello, medical terminology students. This chapter is, we, sorry, we're jumping here. So we just got done with chapter 4, and now we're jumping all the way to the back of the book to chapter 22. Um, and I will let you know that the reason I did some jumping around is because some of the chapters are longer chapters and some of them are shorter chapters. And I tried to um, work together chapters that aren't going to be super heavy for you. There still are some weeks that are going to be like that, and I apologize for that. It's really not much I can do, but you'll find that that's going to happen in this course where you're not going to go in sequential orders. Just make sure you pay attention to that. We're now into chapter 22, which has to do with pharmacology. So let's begin about pharmacology. Pharmacology obviously has to do with medications, drugs, either whether it's over-the-counter medications or prescription medications, it still doesn't matter. Pharmacology means the study of drugs. When it comes to um, the drug name, there are three different names that a drug has. And first, when companies like put together chemicals to create a component that creates a drug of some sort that's going to go into your system. They have to name it, they have to give it a chemical name. And the chemical name, look, if you look in your book, there's a super long example of this chemical name that makes no sense to me. But it's the components that are combined together uh, that make one drug that goes into your system. So that's the chemical name. Then look in your book and see this long one. Then the manufacturer then has to create a generic name for it. That's going to be where no matter which manufacturer sells it, that generic name is going to stay the same. And then the trade name is a brand name. So when a drug comes out on the market, a manufacturer is going to create this drug and they're going to have a brand on it. They're going to have a patent on it. It's going to be theirs for a certain period of time before other companies can actually create a generic form of that medication. So the example that I give for a generic name versus a brand name is Advil. Advil, the generic form of Advil is ibuprofen. So ibuprofen is sold everywhere. I mean, Walmart has a brand, right? Or not Rite Aid, but Walmart, Walgreens, CVS Pharmacy, Meyer, and then several others. They have their own version of ibuprofen. But the brand name, a brand name of that when it first came out is Advil. Another example is Tylenol. Tylenol is actually the brand name from the manufacturer who created Tylenol, otherwise known as acetaminophen. So if you say, okay, we're going to take a Tylenol for a headache, well, that's going back to the original brand name. Most people don't say, I'm going to take acetaminophen for a headache because, for one, saying Tylenol is so much easier than saying acetaminophen. In addition, we got used to saying Tylenol because that's how it was first created. So there you have it, the different drug names. Then we go to the different drug types. So here we have over-the-counter medications. These are ones that you can just go to the store, look on the shelf like this gal's doing, and then pull it off the shelf and purchase it. You don't need to see your provider. You don't need to have a prescription for it. So let's take a look at what analgesics are and then what antihistamines are. If you look at these terms here, you're going to see that they have some prefixes, words and suffixes. So analgesics, take a look at this. We've got both a prefix, a root word, and a suffix to find the definition of the term. Really, an analgesic is a pain reliever. This here, it says pertaining to without sensation of pain. That's what it means, but really a form of a pain reliever is going to be that ibuprofen or the acetaminophen. The next one that we have is antihistamine. You can see on here that we only have a prefix. There's no suffix in here, but we have a prefix we have a root word, and then the final, we have an actual combining form because we add an E at the end, just again, for the fluidity of the term. Antihistamine is when you have allergies. Histamine a chemical, or I should say, a product of your body when you get an allergy that your body creates to fight that allergy off. And then you get the runny nose and the itchy and the sneezing and the watery eyes, and antihistamine is going to help stop that chemical component from actually causing all of those, that itchy, watery eyes, sneezing, runny nose, that type of a thing. And then you have areas like just vitamins, minerals, and supplements as well. I'm going to go through this actually pretty quickly. You guys can read about the drug standards, prescriptions. The provider has to have specific criteria in order to write prescriptions. The Federal Drug Administration is the one that oversees any type of prescribed medication, and there are some over-the-counter medications that they oversee. They don't oversee like your vitamins though, your supplements. Those are not overseen by the Food and Drug Administration. The other component of medications that we come into are controlled substances. Controlled substances are medications that have a higher risk of becoming addicted to them. And so that's why these are controlled substances where there's a lot of rules and regulations that providers have to follow in order to write these prescriptions. And because of our opioid epidemic, our drug overdoses that we've seen in the past couple decades, the crackdown on these controlled substances has been pretty, really strict. And I'm sure some of you are familiar with it. You go to your doctor, you go to the emergency room, they might give you an injection of a controlled substance, and then they give you 1 or 2 days supply, and then that's it. And it didn't used to be that way, but this is their way of kind of curbing the opioid epidemic. There are 5 different categories of controlled substances, 1, 2, 3, 4, and 5. You can see they're identified here as Roman numerals on page 700. And oh yeah, that is page 700. It's a big book. It'll show you the different schedules and what they mean. And it really has to do, each category is whether it has a medical use or a higher risk of addiction. So like in Schedule 1, Schedule 1 states on here that these have a high potential for abuse, and there's no federal accepted medical use for treatment for those medications. And then Schedule 2, there is a medical use, but that's just a less higher risk of addiction or abuse than Schedule 1, and then it decreases as the numbers go down. These are some examples of Schedule 1. So heroin and LSD is a Schedule 1. And you can see on here, actually right now in the federal law, there is no medical use for marijuana, even though there is prescriptions, and that might change down the road. Even though marijuana use is legal in Michigan, the federal law states that it is still illegal. So just be mindful of that. Schedule 2, here's some examples. Morphine, oxycodone, amphetamine, and cocaine. So you'll see your amphetamine in your ADHD medications. And yeah, you can see cocaine does have an actual medical use. One of the medical uses for cocaine is they use it in a droplet form when you have nosebleeds. If you have a nosebleed that won't stop, you can go to the emergency room and they'll actually tip you back and they'll put cocaine droplets. Of course, it's prescribed and it's a controlled form. They put cocaine in your nose because it's a vasoconstrictor, and it actually helps to close off the blood vessels to stop the bleeding so they can identify where that bleed is coming from so that they can go in and cauterize it and take care of it. Anyway, that's one use for cocaine. Controlled 3 substances, we have your Vicodin, which honestly, Vicodin no longer exists. It's actually, oh my gosh, there's a different one for it. Tylenol with codeine, because the codeine is the actual controlled substance of that. And then we have Schedule 4 benzodiazepines, which and then hypnotics and analgesics. We have Valium, Xanax, Ambien, and Ultram. Your Xanax and Ambien, or no, Xanax would be your benzodiazepine. Ambien is actually going to be hypnotic. It's actually going to put you to sleep. And then you have Schedule 5, which again, it's the lowest level, the least risk of abuse. Robitussin AC, a cough syrup, is actually a really good example of that. That works really, really, really well for uncontrolled cough. But again, you have to have a prescription for it. So then the next section that we talk about is the actual administration of drugs. There's several different ways that drugs can be administered. Oral through the mouth is just one way. So the other thing is that different drugs have different type of effects on you. You can have a local effect. So if you have, let's say you have a fungal infection, you've got a rash on your skin, you need to put antifungal medication on it, that's going to have a local effect because you're going to want it just to the area of the skin. You put a cream on it, it takes care of that rash. A systemic effect is where it goes through your entire body, whether you take it through your mouth or you insert it as an injection, or sometimes like rectal. There's rectal suppositories that Tylenol can be a rectal suppository. Like if you're vomiting and you got to get rid of pain, you can't take it orally. There's a rectal suppository so it doesn't exacerbate the vomiting. Routes of administration. Here are some other terms that you might see throughout the course: bioavailability, formulation, pharmacokinetics, pharmacodynamics, toxicology. And if you look on page 703 in your textbook, you'll be able to see the different terms and the definitions of these. But really, if you look, you can see that all of these just have either root words or combining forms, and then they have suffixes. So you can take a look at your chapter and figure out what those different terms mean as far as routes of administration. Under here we have enteral. There's several ways that it can be that drugs can be administered in the enteral form. It's oral, sublingual. Buccal means in the cheek or rectal. And then we have topical, ointments, eye drops. Inhalation is considered a topical. Pessaries, and then transdermals. So let's take a look at these definitions of routes of administration. And you'll be able to see this on page 704. There's the table in there. Again, breaking down the term and identifying the prefix, root word, or combining form, and the suffix. You'll be able to give a definition of oral, sublingual, buccal, rectal, and transdermal. Parenteral, when we say parenteral, it's going to be in another form other than through the mouth or the GI system. So this bypasses the GI system. And when we say parenteral, we're really talking about injections or infusions. So here are the different forms of parenteral medications: intramuscular, intravenous, subcutaneous, intradermal, intrathecal. And look at the terms, breaking it down to identify the actual true definition of these routes of administration. When it comes to safe medication administration, we want to make sure that we are following all of the guidelines and all of the recommendations for that medication. We want to make sure that we aren't overdosing our patient, or that we aren't giving them a medication that would cause an adverse effect or an adverse reaction, or even a potential side effect as well. So when we're actually giving medications, we have to make sure that we follow the rights of medication administration. Here are 5 rights. There's actually more than 5 rights, but our book just talks about 5 of them, where you have to make sure you have the right patient, drug, route, dose, time. And then when it comes to abbreviations, there's a lot of abbreviations when it comes to medication administration or pharmacology. And you might see these depending on which allied health pathway you're going into. So I'm just going to pull these up for, oop, we are going to go to, I want to, hold on, bear with me, go to the back. There we go. So let me take a I know that a there's a table in, yep, a table in your book on page 710. These are some common abbreviations that you're going to see in medication orders. And again, it's all memorization. So I believe that there are going to be some questions on your test or your practice questions that have you identify what these mean. Again, my suggestion is to make flashcards on these. All right, so we've got some more here. Oh, went too fast. These are some more abbreviations that you might see in when you see prescriptions. So again, just make some flashcards so that you know what they mean. And then there are some other abbreviations as well. So you have the DEA, FDA, OTC, and USP. We actually already talked about some of these. The Drug Enforcement Agency, this is the agency that oversees the controlled substances. FDA, we already talked about. Food and Drug Administration, they're the ones that oversee all prescribed medications and even over-the-counter medications, except for your vitamins and supplements. They don't oversee those. OTC means over-the-counter. And then USP means the United States Pharmacopoeia. Some other terms that you're going to see, again, this is just kind of a little review. Let's just open them up one at a time so you guys can review these. Again, like I stated in my other videos, is look at the term, break it down, identify the prefix, the root word, and the combining form, and then the suffix, and then determine what the meaning of each word part is, and then put it together to determine the definition of that entire word. Such as, let's look at synergist. Synergist. We have a prefix, which is syn, that means together. Erg means work, and then ist is a specialist. So a specialist that basically work together. This one's kind of a off one. So a synergist is when you take two things and you combine them together to work together to increase the benefit of whatever it is that you're doing. We can have synergistic relationships between people that we work together and create a better outcome. So many hands make lighter work is one of the synergistic things that we can do. We work together to make lighter work. Let's go to narcotic. A narcotic, we have a suffix, tic. Narco means sleep. So this is pertaining to sleep. A narcotic is going to help you sleep. So again, take these terms, break them down, and then identify the definition. That's it for chapter 22. I will see you in the next video.